Hi, welcome back to the School Health Shoutout, bringing you the latest research happenings in school health. Today, should talk about our sponsor, vests. The visors of outerwear, vests. Thank you for sponsoring School Health Shoutout today. So the article we're discussing today is Hand Hygiene Program Decreases School Absenteeism Due to Upper Respiratory Infections. With the coronavirus happening in the United States and spreading pretty quickly, hand hygiene is of utter importance, especially in schools. Okay? So that's what we're going to be discussing today. Bottom line up front, the hand sanitizing and hand washing with soap accompanied by educational support is an effective means to reduce absenteeism due to upper respiratory infection. Okay? So the reason that we're looking at upper respiratory infection here is because that is also something that where hand washing and hand sanitizing can be an effective means of decreasing transmission. Okay. So in this, there was an experimental group and a control group. Control group wasn't really told anything. It was like, hey, keep washing your hands as usual. Whereas in the experimental group, they had a 2-hour workshop 1 month prior to the study beginning. During that workshop, they talked about the most frequent infections that happen in schools, how they're transmitted, but also how they're prevented, how and when to wash your hands, and then also how and when to use hand sanitizer. So the rules for hand washing were when your hands are visibly dirty or when you use the toilet. Okay. Hand sanitizer, on the other hand, occurs when coming to class, before or after lunch, after a break, after phys ed, when you go home, and after coughing, sneezing, or blowing your nose. Okay. Now, this intervention happened with a group of 4 to 12-year-olds, so kind of like what elementary would be here in the U.S. And so they supported this with teachers and research assistants every 2 weeks coming in using stories, songs, and posters that are linked to hand hygiene and disease transmission. And as a result, they saw fewer upper respiratory infections in each month in which data was tracked. Now a word from our sponsors. Are you going on a date to Cracker Barrel on Saturday before running errands? Throw on a vest. Vests. Give sleeves the warm shoulder. Vests. Warm core, warm hearts. Life is short. Get better outerwear. Let's get vests. So a few things that schools need to consider when thinking about this and thinking about hand hygiene. Okay. Number one, got to remove any barriers there are to hand washing and hand sanitizing. So if you don't have a means to dry your hands, people don't like walking around with wet hands. If you don't have a way to dry your hands, people aren't going to wash them. Okay. And also, we know that soap is a big difference maker when it comes to actually getting clean and germ-free hands. So if there's not soap available, make soap available. Soap's not expensive. Get the job done. Okay. Same with hand sanitizer. I understand that one's a little bit more difficult. I know when I was a teacher, I would buy my own hand sanitizer for the classroom, but that's something where school districts really need to take the onus of control and not rely on individual teachers for that to happen. Second, students and staff should understand hand hygiene, and the educational piece behind that is super duper low cost. Okay, soap is inexpensive, hand sanitizer is relatively inexpensive, but the knowledge piece here, this is basically a free intervention when it comes to distributing the knowledge that's associated with how to wash your hands. Okay, and lastly, students are going to take this knowledge with them, bringing it back to their homes, bringing it back to their communities, but also they'll take it with them later in life. So 3 main points to consider here. Lastly, we're going to end with a few words from vests. Vests, the official outerwear of early fall. Want to look nice but don't want to iron your sleeves? Oh, I'm sorry, but you only want to iron the sleeves. Put on a vest. All right, that's all we've got for you today on School Health Shoutout.